Being a lactation consultant and working with breastfeeding mothers and babies is a very rewarding career. If this is your dream, Lactation Education Resources can provide the training necessary for you to become eligible for the Lactation Consultant Certification exam. In this video, we'll discuss Pathway 1, the pathway for healthcare professionals. Welcome. I'm Virgie Hughes, the Director of Lactation Education Resources. We've been training lactation consultants for over 20 years, more than 3,000 so far. Let me explain the pathways to certification and the programs that we offer to help you meet those requirements. Pathway 1 is primarily for registered nurses, registered dietitians, certified nurse midwives, dentists, occupational therapists, pharmacists, speech therapists, physical therapists, and physicians. Anyone who has a healthcare license. This pathway also includes breastfeeding support counselors, such as La Leche League leaders and other peer support counselors. Please check the IBLCE website to see if your mother-to-mother support group is listed. This is the easiest and fastest way for healthcare professionals to become eligible for the certification exam. A comprehensive lactation course of a minimum of 90 hours is required within 5 years prior to the exam. You will also need 1,000 hours of clinical experience. Most health professionals have already obtained their clinical experience through their paid work. Whether you're a health professional working in maternity or are working in a clinic setting, you can accumulate clinical experience hours based on how much of your time is actually spent assisting, coaching, and teaching breastfeeding mothers. Only the hours where actual breastfeeding education and counseling are done will count. Most people estimate that 15 to 25% of their day is actually breastfeeding instruction or counseling. In-person as well as telephone counseling is included, as is teaching a breastfeeding class. The total time needs to be 1,000 hours over the past 5 years. General supervision is required for this pathway. That means if a supervisor is aware of your duties, your performance, and the hours that you work, it does not need to be a lactation consultant. If you're a health professional but have not been working in maternal-child health, you have the option of taking Pathway 3, which involves a clinical internship of 500 hours, to meet the clinical experience requirement. Please view our video on Pathway 3 and clinical internships for details on this. There are 8 college courses required that are usually covered in the basic education to become a medical professional. These are human anatomy and physiology, biology, sociology or cultural sensitivity, psychology or counseling or communication skills, infant and child growth and development, and research or statistics. These general education classes most health professionals have had in their workplace. If you're missing any of them, they're available online from Lactation Education Resources. Medical terminology, safety and security, medical documentation, ethics for health professionals, universal safety and infection control, and basic life support. All of these are available from LER, except for the CPR, which of course must be taken locally. Our Enriched Lactation Consultant Training Program meets the requirements for 90 hours of lactation-specific education and covers all of the topics in the IBLCE exam blueprint. Our course offers both CERPs, which are education credits for lactation consultants, nursing contact hours for nurses, and CPEs, which are for dietitians. Our Certified Breastfeeding Specialist credential is available at the end of this course. It's a recognition that you have completed specialized education and have expertise in helping breastfeeding mothers and infants. It might be helpful in obtaining employment while collecting clinical practice hours. We encourage students to go the next step and take the IBLCE certification exam when they're eligible for it. If you already have some breastfeeding support training but need an additional 45 hours to qualify for the IBLCE exam, the core course will be for you. Be prepared to spend some time and effort to become a competent lactation consultant. This is not training to rush through. First of all, you want to pass the exam on the first try, and second, and most importantly, you want to give good advice to the mothers and babies that you care for. Being a lactation consultant is a very rewarding career. You know that you're helping moms provide the absolute best nutrition and parenting for their babies. We applaud your commitment to new mothers and their babies, and we're here to support you with excellence in lactation consultant training.